Hello, I'm Irena from Paradox Association, which stands for Paris Clay PhD and postdoc students. And we have with us today Moredereck Chibi, a PhD and the regional advisor of World Health Organization. Hello, Moredereck.
Hello. Thank you for having me, Irene.
Thank you for being with us today. Moredereck, you have a very interesting career path from a PhD in South Africa to a regional advisor of World Health Organization. Can you tell us more about your journey? Maybe you can start from where you did your PhD, what's bring you to the science, and when you decided to become a healthcare manager.
Yeah, that's an interesting question. I can say my career pathway was mainly shaped by what problems I wanted to solve, especially among the African people. So they normally say in life you don't need to pursue a career that you'll be entitled to become, but rather you should identify the challenge that you want to solve and probably use that either career or qualifications as a vehicle that will ultimately see you attaining that outcome or goal that you want to achieve. And this is precisely a brief description of my career path. So when I started doing science, I was naturally good in sciences. So, and also my parents encouraged me to take that route. But as I was going through that path, I also realized that I can use science as a vehicle to effect direct impact in the lives of people. And the only way I could do that was also to somehow come out of the fundamental science and also the applied science and go out in the world to use science to make a change in the lives of these people. So that's in a nutshell how I can describe it.
Oh, thank you very much. That's a very interesting story. Like you wanted to make an impact and that's brought you to the science and then to the healthcare management. Just for our viewers, can you repeat some details of your career path? So what was your PhD about?
So my PhD was in biotechnology. So I wanted to try and understand the mechanism of this protein called retinoblastoma binding protein 6. Its pathogenesis or its mechanism of action that was implicated in cancer genesis. So that was very much the area that I was very much involved in. So I had to find what are the molecular mechanisms of proteins that are either upregulated or downregulated, and that will result in a phenotype that is cancerous, because I was dealing with mammalian cells just to try and manipulate and see what is the effect if I downregulate and upregulate this protein. And the findings were very interesting. And I remember I published my first journal, which was highly cited, and this was my initial route to having a postdoc in Paris.
So you did your PhD in South Africa, then you moved to Paris. And in what moment you decided to come to healthcare management? How it's happened, if I may ask?
So yes, so when I was in Paris doing my postdoc under the supervision of my excellent supervisor, his name was Dr. Deforces, Anton Deforces. So when I was interacting with him, and I can actually qualify him as my mentor, other than just being my postdoctoral supervisor. So I used to share with him my ambition of working directly to save people's lives and using science as a vehicle. Then he was also pointing to me some pointers and tips on how I can actually leverage certain networks or even other career pathways that may result in me accomplishing that dream. So he was the one who actually recommended that Switzerland could be one possible country that I can derive so much experience, because as you know, that Switzerland is an innovation country. So I had to latch on that and take advantage of that.
Okay, so your postdoc coordinator in Paris recommended you to move to Switzerland, and in Switzerland you pursued an MBA in École Polytechnique de Lausanne. That's it?
Exactly, precisely. So when I was in Switzerland, because the world of innovation was open to me, and I was very much excited to find this executive MBA program in innovation management and entrepreneurship, and mostly focusing on biotech, pharma, and med tech. So it was very specialized kind of MBA program.
And when do you decide that you want to work for World Health Organization? Was it during your MBA or before, or when you applied, you already knew that you want to do it?
So when I was doing my executive MBA, so it was that time where I was supposed to do a project, and because of my natural background, I thought it would make sense to do my MBA project with WHO. So I found ways of reaching out to the department, specifically a unit that was specializing in an area that I really wanted to do a project with. So I identified my first supervisor then through an email. Then he invited me for an interview. When I tabled my proposal on what I really wanted to do with respect to my MBA project, then he just jumped to that opportunity, because I think to him the proposal was just too good for him not to resist, and the rest is history.
Okay. Yeah. Yes, thank you very much for sharing this story with us, because, you know, career path, it's not so evident. I mean, we are thinking what we want to do. It's not usually easy thing to decide. So I see that on your example, we can see how your values, your desire to change the world, to make an impact, how it helped you to come through, to come to do a PhD, then to do a postdoc, then to do an MBA. And it seemed that you, all this time, you were really driven by your values. I mean, like the values to make an impact. Maybe you want to tell more about what is your values and inspiration in your job.
Yeah, so I mean, it's very important. What you just said, it's very important to any PhD student and any postdoctoral student out there, that you need a guiding star in life. You need to adopt that outcome in mind mentality, if I may say so, and that guiding star is the one that is going to make it easy when you're going to make decisions. And I can tell you, I also made decisions against certain lucrative, so to speak, opportunities because I felt that they were going to deviate me from my overall ambition or goal. So it's you can actually attribute that to values, underlying values. But I feel it's more appropriate to say you have a guiding star that you aim for. So wherever you're working, you may not necessarily, it can be difficult, it can be really challenging, the terrain can be really very heavy. But as long as you're taking one step in that direction where your guiding star is leading you, everything will become history at some point. You get where you want to be. I think that's what I can say was more like the driving force for me.
Okay, thank you. Well, now what is interesting for us, it's actually your job. What are you doing at your job at daily basis? Maybe you can tell us what the main challenges of your work and what do you find the most exciting about your work? So tell us more about your work, please.
Interesting. So in a nutshell, I work in the African region where I support countries to implement innovative initiatives, implement emerging technologies, implement innovations and digital solutions to accelerate health improvement. So how do I do this? We do it, one, in helping countries to identify needs-driven and contextualized solutions and facilitate scaling of those innovations, and also monitor and evaluate impact those innovations that we're helping countries to implement. And monitoring and evaluation is also key, as that could also lead to certain policy changes that can also lead to some infrastructural investments, and also it can also lead to certain capacity or skills development approaches. So I find my work very, very cutting edge, and as you know that innovation is a key differentiating feature for competitiveness of either a company or even a country. I was talking about Switzerland, and it's an innovative country, and many countries in Africa are warming up to that idea that leveraging innovation is one gateway of leapfrogging improvements in their health systems.
Okay, well, that's great. Maybe you can just precise what country are you talking about? So with what country you work?
So, so I am based in Congo Brazzaville, which is the regional office for WHO in the African region. So I can say it's the regional headquarters. So my work entails supporting 47 member states in the work that I've just described. And you also asked about some of the challenges that I'm facing right now. I think it's very much natural to say the global pandemic is really opened opportunities, but in a challenging way. And this is a disease that is affecting almost every area of our work. And it has also presented opportunities for so many innovations, so many emerging technologies, so many new ways of doing business. So we take it in both ways. In as much as it is challenging, it has presented us with these unprecedented opportunities that we really want to take advantage of in our quest to remodel our healthcare delivery mechanism in the country.
Yeah, great. So that it's true that global pandemics like changed everything today. It's I imagine that it's impacting your work too. Do you actually work on the access to vaccination in your region?
We do. Now, compared to the rest of the world, I can say Africa is trailing behind in terms of the vaccination rolling out of COVID-19. But suffice to say, countries are picking up in terms of rolling out that COVID-19 vaccine. And I've just received my SGF today. I'm so excited about that.
That's great. I mean, it means you really make changes. And I imagine it's what you wanted to do when you started your work. Okay, thank you for sharing all of it with us. And now I'm going to proceed to the part which is interesting for our PhD and future PhD viewers. So come from so you path from science to original to management. Is there some of your experience and knowledges that you gain like a scientist that you can use in your work today, like in terms of skills maybe and experience?
Certainly. So like I told you before, all these qualifications, they don't necessarily define you. The only thing that you need to use your qualifications is for them to be like a leverage points or even a mechanism to pursue your dreams. So I don't regret a bit having done like a PhD in fundamental science, in applied science, in biotechnology. You know, I've cherished the moments that I've been really doing that, and I gained so much wealth of knowledge and experience. And it's true when they say just getting education opens your brain, opens your way of thinking, how you interact with people. So I find that wealth of knowledge, wealth of experience, especially from the research background, giving me a head start in terms of the work that I'm currently doing. And that fundamental or content in terms of my education is very, very key. And it's very easy to navigate around certain issues. And like I said, now I'm using the evidence-based approach when I'm making an impact on the ground. And this evidence-based approach is driven by my background as a scientist. And I'm so excited about it.
Okay. Well, I see. So you mean that your deeper knowledge on your subject help you to make decisions. And I imagine that as a scientist, you used to work hard and its impacts, you continue to work hard today. So the skills you gain, basically you use it in your work.
Yeah.
And
so when just to interject there, so I remember when I was a PhD and a postdoc at the same time, we used to joke to say you should have two bedrooms, one in the lab, one at home. So you can imagine you can spend the whole night in a lab working on an assay. So that culture of hard working, like you're right. So it's something that's naturally inculcated in the way you do things. I start my work at 8 and normally I finish at 8 p.m. And for me, it's natural, although some people think I'm overstretching myself, but it's influenced by my background as a PhD or as a postdoc, as a research and development scientist. So to me, it's natural. So you're right.
So, Moredereck, can you tell us more about World Health Organization and what are the job opportunities for PhD students today in this organization?
Yes, WHO is an organization that advances global health agenda. So for PhD students, there are lots of opportunities that are at their disposal. And normally or traditionally, people used to think for someone to work for WHO, you should be a medical doctor. And WHO has since reformed from that notion. You realize that there are so many people with diverse backgrounds for as long as they contribute to the mission and vision of WHO. And WHO is in that crusade of attracting talent, regardless of the background. So I would advise PhD students, postdoctoral students, to scout for opportunities, network, and try to understand how not only WHO, but UN in general functions, because it can be an exciting moment for you to work for organizations like WHO or UN, especially if you are oriented towards making a difference in people's lives. And this is precisely what United Nations WHO specifically does.
Mm-hmm. Okay, thank you very much. And you know, the one question we always ask our interviewee, do you recommend today's student to pursue a PhD? So PhD in 2021, what do you think about?
Yes, actually, I still come back to my original argument to say a PhD is nothing when you don't have a strategic plan on what you want to be or what you want to do with it. Because what I've realized with many PhD students is that an opportunity avails itself, then you do a PhD. And in most cases, they end up being trapped in academia, especially if they don't want to remain in academia, because of that guiding star that I was telling you about. So yes, if I was to do another PhD, I would certainly do another PhD for as long as it's aligned to contributing to my goal or career goal, what I want to do in life, what problems I want to solve in life. Like I said, as a PhD student, just try to think, what problem out there do I want to solve? Or instead of you asking, telling yourself, what do I want to become? You know, there is a difference between what you want to become and what problem you want to solve. So just to encourage PhD and postdoctoral students, now you need to have that paradigm shift in the way you look at the world. World is infested with problems and challenges, and because of your intellectual capacity, you can contribute to solving some of these problems instead of you being entitled as a doctor, as a professor, and change that paradigm shift, and you realize that your life becomes very, very easy and satisfactory.
That's an interesting idea. So basically, PhD can be an instrumental to your goals. Well, thank you very much for sharing it with us, and thank you for being with us today. So we have Moredereck Chibi, the regional manager of World Health Organization. Thank you for being with us, and please like our channel and subscribe to it. Thank you, Chibi. Bye.
Thank you very much, Irene. Thank you for having me again. Bye.